Good morning, everyone. We make a start now. I've just been informed that we've got some colleagues who've already joined us online, so we won't subject them to any more chatter from our table. I'd like to start by acknowledging the traditional owners of the land that we are meeting on today, the Wurundjeri people of the Kulin Nation, and as well as the owners of the land where our colleagues are joining us from today remotely. We acknowledge that sovereignty over the land and waters were never ceded, and pay respect to Aboriginal and Torres Strait Islander people's strength, their cultural heritage and their continuing connection to land, waters and community across Victoria and Australia. I pay my respects to the elders past, present and emerging, and extend those respects to all First Nations people who are joining us today. My name is Stephanie Busby. I am the Acting Director of PVAW with Domestic Violence Resource Centre. Recently joined the team in November. Many of you would know Krista Seddon, who is enjoying time with her new baby. So it's great to be with the team, great to start the year with this first PIP seminar of our 2020 series. We've got a great panel that I'll introduce in just a second, and we're really excited about digging into some big ideas around evaluation, what it means, how to do it, and how to make it work for us. But first, I want to take the liberty of talking a little bit about what's happening with PIP and with the DVRCV prevention team this year. Giving a little bit of a plug to our next seminar, which will happen next month on the 12th of March, which will look at engaging men and boys to prevent violence against women. And we've got a panel who will be exploring how to effectively frame our work to engage men and boys in our work. We've also got Prevent X 2020 coming up at Story Hall at RMIT City Campus on the 1st of April. So some of you may have joined us last year, which was an excellent event. It'll be the same interactive conference model, and we've got a really incredible speaker and workshop lineup. The team have worked really hard on pulling together a really exciting agenda. So I hope many of you will join us there, but I will note that tickets are selling fast, so you'll be able to find the links on the registration to registration on the agenda on your seats. We've also got a few different trainings coming up. I just want to mention, want to draw particular attention to our Unpacking Resistance one-day training that's coming up on the 19th of February, and our Introduction to PVAW one-day course on the 27th of February, which is a great one to recommend to any of your colleagues who may be looking at starting a career in prevention, or just anyone who wants to broaden their knowledge and skills about what they can do. And all of the details on those training offerings are on DVRC's training page. But what you're all here for today, talking about evaluation, we know that evaluation means different things to different people. It can feel a little bit inaccessible and impenetrable. It can be an invaluable tool to facilitate evidence-based learning and to amplify our project impacts. It can also feel like a box-ticking exercise sometimes when we're busy and concerned with the rest of the work that we have to do with limited resources, capacity, and support to do it. What we want to discuss in today's panel is why we should evaluate our projects and look at the benefits of it. We also consider the challenges and the complexities that are unique to prevention evaluation. And ultimately, what we want to look at is how we can do the evaluation work in a feminist and intersectional way. We'll have time after the panel for questions. And so if for any of our colleagues watching online, if you can please put your questions into the chat window next to the video, and we'll be able to get to some of them through the discussion. We are live streaming this event, obviously, I keep mentioning, and the recording will be uploaded to DVRCV's YouTube channel afterwards if you want to share it with any colleagues. But I will note that we're only filming the stage, so don't need to worry about the audience appearing in the video. So with all of that lengthy preamble, I'd like to introduce our panel. We've got Monique Bomer, who's the PVAW coordinator of Women's Health in the North. Monique has worked in the field of preventing violence against women and promoting gender equity for 10 years or more than 10 years in local government and women's health sectors. She is working with Women's Health in the North to coordinate preventing violence against women team and lead the implementation and evaluation of the regional prevention strategy, building a respectful community. Catherine Adey is from Multicultural Centre for Women's Health. Catherine's been with NCWH since 2019 as the PVAW team leader, and she's dedicated to addressing gender inequality and other intersecting forms of inequality to prevent violence against women, and draws on a decade of experience in the disability advocacy and research sectors. Catherine is supporting 7 projects to prevent violence against women in refugee and migrant communities across Victoria, with activities ranging from capacity building and training to workplace intervention and participatory action research. That's a mouthful. And finally, Lucy Leung is a research and evaluation lead from the Equality Institute. So with EQI, Loxy coordinates the implementation of their global research agenda. She's committed to applying an intersectional feminist approach to research and evaluation, and has over 10 years of evaluation and policy experience working for government, intergovernmental organisations and not-for-profit organisations in Australia, Southeast Asia and the Pacific. I'm super excited about the wealth of experience and the different perspectives that we've got with us today. And so to start with, given the different backgrounds and the different kind of levels of work that you've all been part of, I'd like to invite you to give us 2 reasons why prevention practitioners should care about evaluation when they already have so many other priorities to juggle with.
You want to go first? Oh, right. Okay, so I guess, similar to general health promotion work, we need to know that our work is effective, that we're not wasting our time, money, and the time of the participants in the work that we're doing. We know how to improve our practice. And I guess, because I'm speaking from a partnership point of view, particularly for partnerships, because they're quite resource intensive, that you're, people attending meetings, contributing to shared work. I think we also have a special obligation for those of us that convene partnerships to make sure that we are adding value to the work and not just doing it for partnership's sake.
Thanks. I thought we'd probably have pretty similar answers. Yeah, similarly, it's so that we can do our own work better, so that we know how to plan our projects, so that we can allocate time and budget accordingly. I think that's what we're always learning, especially because PVAW funding is quite new. So knowing, we're kind of figuring it out with the first few projects, how budget should work. Sorry. And then also it's critical for us as an organization to contribute to the evidence base around what works in migrant and refugee communities to prevent violence, and also to make the case to be able to request specific funding for that work, and particularly to build evidence around change the story and how migrant and refugee experiences relate to change the story.
Yeah, so it was difficult to just choose 2 reasons, but going off what Catherine's just said, I guess remembering that prevention is an emerging field, so there's still, it's really important that we all contribute to the evidence beyond just finding out what's impactful, what's working in the project that you're working on. Sharing that learning with other people in the sector is really, really useful. Sharing that globally as well is really, really useful. So I would really encourage people to learn from each other and using evaluation as a way to do that. The other thing, and both of you have kind of touched on it already, is that, obviously on one hand you want to capture stories to report back to your funder and say this is working or this is not working, but also, and that's usually the obvious purpose for evaluation, but there's also an opportunity to tell stories using evaluation, and if we're in the business of behaviour change, then capitalizing on evaluation and monitoring and evaluation as a tool that then is used for behaviour change. If you share a story wider with the general public or just with a wider audience, then it could then be transformative for people who see that work and believe that change is possible.
That's great. And I think that that's a really wonderful way to set the scene for our discussion, looking at those multiple layers of benefits from the kind of internal facing planning to making donors happy that they're investing well, and then the broader societal benefits. So going from there to some of the specific examples that you've all worked on. So Monique, the Building a Respectful Community Partnership has just published their evaluation report from Women's Health in the North published their evaluation report in December last year. It's a massive undertaking, both the project and an evaluation of a project that size or an initiative that size. Can you tell us a little bit more about Building a Respectful Community and the process of planning for and implementing an evaluation?
Sure, yes, thank you. So just as a little bit of context, Building a Respectful Community Partnership has 24 active partners, including government, community-based services and health services. And this is our second regional strategy, so a lot of the partners have been involved for quite a long time. With our previous strategy, we did a partnership evaluation with Dr. Deborah Weston. So when we came to planning this next evaluation, I guess our priorities were that we were seeking to evaluate not just the partnership and Women's Health in the North's role, but also look at the collective impact of the work across the region, gain insight to improve our practice and the practice of the partners, and guide our decision-making. So the process, we took a participatory and inclusive approach to designing and completing the evaluation with all the partners. So we engaged Wei Ling Kwok as an expert consultant to facilitate. She facilitated a series of 5 half-day workshops with a working group, which had members of the partnership, as well as WIN, or Women's Health in the North, to develop the program logic and the evaluation plan, which then was checked with each individual partner. So everyone was really involved from the start and could have a say of whether they thought it was relevant or to them, or was going to, give them useful information. I guess the second phase of the project, we were offered support by Inner North Primary Care Partnership to develop, by their INSEPT project, to develop an online data collection platform so that it was an easy way for all partners to contribute their data. So, which again took a consultative or collaborative approach where people had input into the actual platform to know that it was going to be practical and useful for them. And then in terms of the data collection and analysis, Melissa Collins from Inner Northwest PCP provided enormous support. We worked in partnership with the Inner Northwest PCP, and she undertook the focus groups. There was data collection by the platform, which was based on Qualitative, and the other types of case studies that were submitted and so on. So she analysed the data, and together with WIN wrote the report. And I think the final step that I found really interesting in this sort of collaborative approach that Melissa had suggested is that the recommendations were then taken to all the partners. So we had our annual planning day, and we had, I think, about 90% of the partners represented, and they all workshopped the recommendations, either that it did reflect what they thought the data that provided, like they thought they were accurate and also practical and feasible. So a lot of the recommendations relate to what actions WIN needs to take, but also some for them and the partnership as a whole. So I thought, yeah, that was interesting for me, the idea that it's not just an evaluator coming and saying, okay, now this is the result, the end, but that we went back to the participants and talked that through as well. So, yeah.
To build in such a consultative process, and it does take some of that, I guess, subjectivity away from the evaluation process. There's that power. It also sounds complicated and time-consuming. So how are you able to get that established as a priority and build it into the work?
Yeah, so I guess there are a number of factors in that. So first of all, I guess at WIN, as the sort of lead organisation for the partnership, has a really strong commitment to evaluation, and that, you know, as part of our, you know, we commit budget, percentage of budget, our integrated health promotion budget to evaluation. Also, we already had an existing strong partnership, and there was an existing strategy and action plan to work from. And then to join the partnership, part of the CEO commitment for that was that they would contribute evaluation data. So we had that commitment from the CEOs, but also also acknowledging all the individual workers, the practitioners and contributors. There was a really high engagement and interest in evaluation from them. So we had that sort of working across all the different levels really came together. But I think something that was important in terms of such a diverse partnership is the different level of resourcing that all the different partners have. You know, there might be some really big, well-resourced and some small community-based. So I guess with that, you know, we're really mindful that it has to be a good use of their time in being involved in it, and they need to be sort of feeling like it's useful to them, and that we built in capacity building opportunity.
Okay, great. So that leads well to again, it seems like there'd be ripple effects of benefits from undertaking evaluation in that way. Was there anything that was surprising in terms of the benefits that you've either heard from any of the partners or for the project as a whole?
I'm not sure, like maybe not surprising, but I guess there are multiple layers of benefits. So there was a lot of capacity building built through it. So from those workshops with Whaling Quok, the partners that chose to be part of that working group, that was an amazing process. Again, time consuming, but also really, definitely capacity building. And then there were additional workshops offered for partners in terms of helping them learn about data collection and how they collect and contribute that data, and then other steps through the way that the capacity building support also from Inner Northwest PCP. I think the other benefit is that the evaluation plan itself is an opportunity to again point us, keep us tied to the evidence base and the statewide work. So in choosing what the indicators are in that, we're making sure we made sure that they are aligned back to Change the Story, referring to the gendered drivers. How is work, aligned with that? So I think also I see that in a way like, so maybe a practitioner that might be fairly new in a project that is part of the partnership, that gives them an extra, pointer or message that this is important, that evidence base, and aligning back to that. So I think that is an opportunity to remind us and keep us tied to that. And the other main sort of, maybe not surprising, but I sort of forgot all about it, the opportunity that it's for advocacy and leadership engagement. So, we were a massive project and then it was done and published, and then I communications and dissemination plan. So we had to sort of, get another boost of energy to get that done. And but it was a great opportunity. We mailed it to all the CEOs of our partnership and CEOs of peak bodies, and to really highlight the work and for them that their organisation is part of, and it's resulted in some CEO and other good feedback at different levels of organisations. So.
Yeah, it's really wonderful to see the different ways that one initiative can spiral out in different ways like that. And much respect to Wim for being able to invest the time in that work. Catherine, I want to turn to a different kind of complexity that you're working with. So you've got 7 different prevention projects that you oversee with MCWH. And you've got different evaluation processes, and I imagine that each project would have its own kind of approach and needs.
Yeah.
Can you talk a little bit about how you determine the evaluation approach for different projects at different scales, and what the key differences might be that you consider?
Yeah, so I guess just for some background, I have been at MCWH for 1 year, so I've been doing monitoring evaluation across nonprofit work for 10 years, but 1 year in the PVAW sector. And so I guess also some more context is that we have a couple of projects that are funded by the Department of Social Services, so that are federally funded to do prevention work, and then also I'll say 3 to 4 projects, because one is about to start up again, funded by DPC, so Office for Women or Multicultural Affairs. So there's a few different kind of frameworks to work within. And sorry, you asked what are the key differences?
So when you've got a suite of projects, what are the different ways that you kind of think through the evaluations?
Yeah, so I guess it's kind of what I said at the beginning. We're always looking at what do we need to give to the funding body in terms of the evidence that they're asking for, and the measures and indicators, which I think is really helpful, because sometimes in some nonprofit work, you're just kind of told, come up with measures and come up with indicators. So it's good that we're all working within the same ones and choosing which ones we use from the Free from Violence framework and the Safe and Strong Gender Equality Strategy, and then also nationally the action plan to reduce violence. So it's good that we have those set measures and indicators, but then of course it's interpretive how we do that. And it's important to know from the beginning, when we're looking at how do we evaluate each of these projects, what do we need to know for the funder, but also what do we need to know for ourselves. And like I said at the beginning, we always want to know what are the barriers for help seeking when it comes to family violence for migrant and refugee communities, what are the contributing factors or discriminatory factors that happen systemically and institutionally for migrant and refugee communities that can vulnerabilize people to experience violence, and also to prevent people from being able to access support. So I think we have some of our own existing frameworks that are feedback forms that we use already. So for example, when our training team delivers training, we have feedback forms that are pretty standard, but then what we do is we'll add in questions according to what we need to know for a specific project. So it's always tailored to the project that we're working on. And we also find other ways of embedding evaluation without making it so obvious, so not just surveys, but also it could be activities through training or through a community of practice discussion where you're assessing, what are people's feelings about this gender driver or this myth of family violence, and doing the same thing when we're working with organizations. So when we're developing the capacity of, for example, settlement or multicultural organizations or family violence response services to work effectively with multicultural communities, doing the same thing, like finding out what do you think are the barriers to access for migrant and refugee women. So that way we're able to record the learning as it happens, but in a way that's not self-reported all the time, because I think that's something that's quite common across all the projects, is that we're trying to measure attitudes and we're trying to measure behaviors, and a lot of things that are really subjective for us to be observed, but then also very subjective for people to be self-reporting. So we do a mix. What else in terms of how we approach things differently? I'll leave it there for now.
Yeah. Maybe can you, if you can think of a couple of examples of the projects that you're working with, are there difference in the tools that you use or like what would be appropriate in different contexts?
Yeah, definitely. So if you're, for example, working, we have bilingual health education sessions, working with, for example, a community that speaks English as an additional language, and the training's being delivered in another language, then we're not going to be, it's very difficult to use English feedback. Translation is expensive, and yeah, we just don't have the time or resources for that. So we find other ways to get the information that we need. So for example, you might have the educator doing a kind of group feedback or voting, or we've had a colleague who's used lots of different inventive ways to collect data. So kind of like a ballot that you could win a voucher if you complete it, and then layering on a word, you know, how you felt about the session or what you learned. So different creative ways to get information that we need, and then we can put it into the format, the spreadsheet, the database, the online system, whatever it is that we have to do. So I guess it's about having fun ways of getting the data and then translating that into what we need it to look like.
And that's great, kind of like storing away ideas, but is those kind of innovative approaches or creative approaches, they happen kind of iteratively, like as you're going, just finding out what works in a particular group?
Yeah, I think now, but I think probably in the next couple of years, if we continue to get this extended funding around prevention work, then I think now we're establishing what are the, you know, I think we'll have a better plan going into each project, how we're going to evaluate, and what are the methods that we use, and then passing that on through, you know, throughout the team and then to new project officers as well.
Okay. You've touched on this a little bit already, but I'm interested to know, or to hear a little bit more about the benefits of evaluating projects that are running concurrently. Like, is there kind of organisational learning or sector-wide learning that you're bringing together as you go?
Yeah, I think first I'll start with the I guess not the bad news, but the thing that, you know, the thing we wish we could do, which I think maybe we'll get to that point in the next few months or so, is to look at all of the projects and look at what are the collective themes and learnings, because we know we're able to look at projects, especially ones that are state funded or federally funded, and see the common themes, and we can write into our evaluation reports common learnings and how they reinforce one another throughout different projects. But it would be great to have an overall oversight of all the different ways that what we've been collecting, what we've been relates to each other. But I think it is helpful to have, I think I've already said, the frameworks, because then it's a bit more repetitive and consistent, so we know what we're looking for. But also it really helps us to be able to tell the same story to funders. So for example, it's our Equality at Work project. We're talking about the casualized workforce, and we're talking about the barriers that women have within the workforce to be able to advance in their careers. And we can also translate that learning to another project we're working on called Safer and Stronger Communities, where Our Watch is leading the workplace equality and respect component of workplace equality and respect within settlement organizations. So we draw on learnings across each project. So that's really, really, really helpful. Yeah.
Okay, thank you. So I want to get a bit of input from you now, Luxie. We've heard from both Monique and Catherine ways that intersectionality is really feeding into your approaches, and we'll hear a bit more about that in a minute as well. But it's been something that's such a key focus of a lot of your work over the years. Can I get you to, and it's intersectionality is something that's talked about a lot at the moment, and there is diversity of definitions, I think. So it would be really great to hear from you about what intersectional feminist evaluation means, and what it looks like in practice, and why do it.
Sure. A lot. That's the thing. So just as a bit of background, the PVAW Institute, which is the organisation that I work for, we do a lot of evaluation and research around the world. mainly in low and middle income countries. We also do evaluations in Victoria and Australia, but quite a lot of the work we do is overseas. And I think there are cross learnings, like the context may sound different, but there are definitely things that we see that run across. So one type of evaluation and research, we conduct quite a lot of large-scale quantitative pieces, so usually household surveys, where we're trying to measure the impact of a prevention intervention in a particular community or country. And for example, at the moment where we've just finished conducting a baseline in Kiribati for the Kiribati government and women for a multi-year prevention initiative that they're running there in one of the islands. And I guess in doing a lot of this work, especially working in a low and middle income setting, my colleagues and I reflect a lot on, how do we do this work properly? Because, if our primary aim is to transform harmful, unequal power structures and address inequalities, then, the work that we do when we're conducting evaluation or research, that process itself should also be addressing inequalities, because we're noticing that within the context that we work in, there's all forms of inequality, often inequalities that benefit me and my colleagues. So whether it's gender inequality or racism or ableism, classism, homophobia, transphobia, the main one that we grapple with a lot is like the neo-colonial sort of inequality that exists in our context. So we've recently put some thought into what it means to take an intersectional and feminist approach to evaluation and research. We recently wrote an article in the Gender and Development Journal called Making Feminism Count, where we basically lay out the principles that we feel should drive feminist intersectional evaluation and research. And this article is, if you want to look at it in more detail, it's really available. Because every context is so different, and you might be thinking, oh, but in Australia it's very different from the small island country in the Pacific. But we have identified clear principles that should help drive us those works. And I mean, there are things that people are doing already, like Monique, you've already mentioned as part of your evaluation, you ran a validation session where you tried to get the community and the people who were providing the information and the data to just check whether it was being interpreted correctly, which then is a way to address that power imbalance between the evaluator and the researcher and the community that's helping you do that work. So yeah, some of the principles around intersectional feminist research and evaluation is that it should be ethical. It should definitely meet the high standards of ethics when it comes to research and evaluation. Asking for consent, confidentiality, anonymity if people request that, reporting back to ensuring that people understand what the information is going to be used for. It needs to be participatory and collaborative. So, I mean, in a lot of what members of the panel have been talking about, we're already seeing a lot of examples of that. And I guess one of the key things is the work itself needs to be transformative. So when the Equality Institute, working in partnership with a local organisation, goes in country and recruits a large team of researchers local researchers who will then go and conduct our surveys, the training that we run, we ensure is transformative. So we don't just teach, we don't just train them on how to collect data or like how to use the electronic tablet where they'll be conducting interviews on. We also build up their capacity in gender-based violence, how it's connected to inequality, and what we hear a lot is that following one of these large research and evaluation pieces that usually run for a number of months, a lot of the team members will come to us and say, and now I see, it's changed my relationship with my partner, it's changed the way I'm viewed in the community, it changed me personally and the way that I view gender and, other forms of inequality. So you can see that how the process itself has tried to, or played a role in transforming some small aspect of the community that you're working in. And I mean, I don't want to go through every single principle, but another one that, one of them that I find really important, and is actually quite an easy one to implement, is ensuring that your evaluation findings are accessible and open. That, I think, is one of the key things around evaluation. Don't just conduct it, send it to your funder, and then that's it. Report back, ensure that people understand what's going on. You kind of owe it to them because you extracted information from them, so they should have the right to hear what has happened with that information. They should have the right to also hear what didn't work. You know, it's not just presenting all the success stories, it's also sharing learnings and challenges and, you know, the things that we probably tend to not want to report on. I think it's really important to be a bit more open about that. And I think that's a key part of taking a feminine intersectional approach to evaluation.
Yeah. And what happens when those findings are contested in a validation session?
Yeah, that's really interesting. So sometimes we often come across, you know, we'll take some preliminary findings back to the community and we'll say, are we interpreting this correctly? Is it something that, you know, makes sense to you? And, you know, sometimes people will agree or they'll disagree on an answer. And sometimes you'll get different groups disagreeing. You can present both sides of that story. So you can just write it up and say, we took this back, we were confused by why we found this finding. Some people explain, some experts explain that it was like this, other local experts explained it this way, and maybe more research is needed, or maybe both are valid.
Mm-hmm.
Yeah.
And have you ever come across any challenges, or maybe to reframe that differently, like how do you go about making a case for the importance of this kind of framing of these principles in evaluation?
Well, we believe that if, you know, if we're, like I think we mentioned before, if we're doing behavior change, then every part of what we do should ideally also contribute to behavior change and disrupting the unequal power structures that we are seeking to disrupt in our work. So if you're doing evaluation, then the evaluation process should do that as well. I also think it gives you better data. Mm-hmm. So if you're adhering to those principles, being collaborative and ethical, all of those things help you get better data. And I would argue it'll give you a better outcome, and it's best practice, and it's right. If you're considering the rights of the people who you're taking the information from, the partners who you are working with, it's the right. I think it's just the right way to do it.
And so for practitioners who are evaluating their current work, and principles sound great, where do they start?
So there's a little document, I think it's a little cheat sheet of like 10 steps to applying intersectional approaches. I don't know, topics that have gone around. This was something that Sarah Tani from Our Watch and I put together for Prevenex conference last year, I believe. And there's some, I feel some of these are easy to do, some of these are harder, but I think, for example, if you look at the practical steps you can take now to applying an intersectional approach to evaluation, number 6 is, just ensure you're, sometimes maybe it isn't as easy as I thinking back, but there are some things that are easier than others, and maybe just reflect on what resources you have at your disposal, what sort of support you have within your organization, and you don't have to do all of them. I guess that's the main point. While the Equality Institute would say we take an intersectional feminist approach to our work, we're really trying. We're not getting it right, I would say. Everyone's just working this out. There are multiple challenges, and I think it's okay to tick off some of them, or try and focus in on getting some of this right, and over time it will yeah, it will become easier. So I wouldn't worry about having to get it immediately right on the first go.
Yeah.
Yeah.
The perfect is the enemy of the good sometimes, right? Yeah.
Yeah.
So coming back to like, you know, as you mentioned, the principles that are applied in international development context have really strong parallels with the work that's going on in Victoria. So maybe naming some of the approaches that that both of your organisations are taking as more explicitly as intersectional feminist approaches. Can you talk a little bit more about how the principles are applied? So maybe looking particularly, Monique, at partnership and navigating and brokering partnerships that are equitable, and I imagine would have spaces of contestation as well around what data should be shared and what's true and what's real. And Catherine, for your work, so maybe looking especially at the Equality at Work project and how you're engaging different communities and how participants are able to access some of the data and findings. Yeah.
Can I just ask that folks speak up a little bit more because it's quite hard to hear.
Oh, I'm sorry. Thank you.
Sure. Okay. So, yeah, I guess it's about how we frame the issue and the question that we're working on. So, equality at work, already we have to understand that there's inequality in the workplace, and that's why we're doing this work. And to go, you know, beyond the gender equality lens, which also I think it's a lot of work because we're just starting to get commitment from organizations now to say, okay, we need gender equality within our workplace. And we hear a lot of resistance around things like, oh, but we have mostly women working here, so it's not a problem. And so then being able to have an organization like Mercy Health commit to saying, not only do we need to address gender equality in the workplace, but we need to address different forms of inequality in the workplace, and particularly given the sector that we were focusing on, around migrant women's casualized work and limited opportunities to advance in their career because of different factors, in like additional caring roles, informal caring roles outside of their work, and discrimination that happens within the workplace, but also from clients. So that's our focus. And I'm sorry, I've completely lost my train of thought.
Okay. So, so looking at how you elevate the ideas of intersectional feminism in the way that you engage with communities and the beneficiaries of your work, how they can access and participate in the data processing and evaluation findings.
Yeah, so it's about explicitly, sorry, that's where I was going with this. It was about explicitly stating what are the power imbalances here, and then making sure that we proceed in a way that makes the power more equitable. And so one way we did that was we had migrant women's forums. We had forums within the workplace so that women could talk about these experiences of discrimination, and also at the same time do capacity building around gender equality and family violence. And then feeding that regularly back to management, but also having training with management, and so all different levels of management, so that staff was equipped to be able to have more sensitive conversations with staff, with care staff, and also to be looking out for and supporting women to advance and just to have a better workplace experience. And yeah, so I suppose it's embedding that capacity building, and then taking those stories, which I think are really important, and then also, using those stories to make the case. But we're always looking at the structural barriers, so we're not looking at individual communities. So I guess if I can take it away from equality at work just for a moment, on one of our projects, Safer and Stronger Communities, we're working with settlement organizations who are working with 2 to 3 ethno-specific communities. And often when we go into do capacity building, thank you. Often when we go into do capacity building with communities, one of the first questions is like, why are we doing this work? It's like we're being targeted, and there's a lot of fear, and it's grounded in it's a legitimate fear to have, that you're going to get negative attention for it. So it's always bringing it back to, this is work that we're all collectively doing to work within the Change the Story framework and to feed into the evidence that's happening nationally, and that this is the reason we're doing this work with different communities is because there's not enough evidence around what's happening in your communities and what's working and the wonderful work you're already doing. So it's not about singling people out. So I think that's our main aim, is to focus more on what are the systemic trends, what are the systemic issues.
So in terms of the building a respectful community partnership evaluation, so I'm not an evaluation expert, but from my understanding as a practitioner going through that process, some of the ways that we, things that we considered in the evaluation is valuing qualitative data, not just quantitative. So the stories of change, the case studies, practitioner observations, and obviously through the focus groups. So valuing that data, being participatory and inclusive, also aiming to diffuse power, like Loxie spoke about, of the evaluator and the sort of lead organisation by having that participatory approach, and creating something that is useful for the participants themselves. But I think that in terms of, like, we're starting to think about our next evaluation now. So something that we're thinking about is exploring that intersectional approach in a partnership sense. So some of the questions we might be looking at is who's included in the partnership, who isn't, why not? Thinking about, in terms of as being the lead or backbone organisation, how are we resourcing the partnership, and are we doing that equitably? And also, how is this work aligning with other social justice work, like anti-racism work and so forth? So just starting to think about some of those things, the ideas that have come to mind so far.
And have you explored some of those ideas already with the partners in the project, or have those ideas kind of come out through the conversations that you've been having?
Probably not extensively. So in terms of over the last couple of years, we've obviously been having an increased focus on intersectionality, and I guess internally building our own capacity, and having some things for the partnership to help build capacity, but and starting to all those things, but we didn't go into those areas in this evaluation. I think partly, the evaluation plan, when it was developed in 2017, was really focused on the action plan, but then again, that points you to go, okay, let's look at the action plan, so why did those things not come up through that? But yeah, that's just where the working group focused at the time that we followed through on, but yeah.
And again, I really appreciate that in all of your comments around intersectional approaches, we've really seen the different levels, and really appreciating what you said, Catherine, about, which really echo what you said, Loxie, around intersectionality, about really being about looking at systemic problems, and also taking a do no harm approach when working with beneficiaries, which in a way, because they are complex issues to turn out, especially in planning and budgeting, I'd like to talk a little bit more about some of the challenges in doing evaluation, and some of which will probably be very familiar to a lot of prevention practitioners. So maybe to start with, get all of your reflections on some of the key challenges that you've either experienced or observed, and also some of the ways that you've seen them addressed. So Catherine, you touched a little bit on data collection itself, but also around planning, researching, partnering, all of the bits. Who would like to go first?
One challenge that I've heard a lot of people raise in doing this work is this pressure to present impact and impact findings when you're really looking at relatively short-term projects. And the funder saying, well, how many people have stopped, being violent, when really, it's not really realistic to expect that to happen in a year or two. And in terms of the solutions for that, I think a very simple way is to, perhaps steer the focus away from your outcomes focus to a more process focused evaluation, or do a mix of both. You don't have to just, pull away from outcomes, but, you can build up the argument for why this work is necessary or what's going right by focusing on measuring some of the process aspects of your project. And then I guess a longer term solution to this is building why this is long term, why it's not realistic to expect to see violence prevalence dropping within 2 years, why you should be measuring things along that trajectory, so measuring attitude change or other indicators that towards positive changes that we're looking to see in the meantime, and explaining how they're all linked together.
Foxy said what I was going to say. I have other things to say. And I think also data can be tricky because you might, like we find that you'll have more disclosures of violence because of the awareness and the talking about it, and so that's a positive thing. But then, so that would contradict the idea that violence is decreasing. But that's just an aside. And I also wanted to add to what I was before and what Loxie was saying before, that, and this relates to one of the challenges, biggest challenges is, firstly, getting people to get involved in a project because of the short timeline, and also because it's additional to a lot of people's work. And also migrant women do a lot of informal and unpaid work. And so to then on top of that say, can you be a part of this advisory group, or can you run an activity in your community? It's a substantial commitment to make over, even though it's a short period of time, it's a long period of time in your personal life, potentially. So that when there is a lack of participation, for example, in the Equality at Work project, it was quite difficult to get a lot of women to come to one forum at one time because of the nature of shift work, and also because with the managerial staff training, management also has different shifts, but also a lot of demands in their work. So we use those kinds of, I guess, unexpected outcomes, or the not the good story that we can capture in an evaluation report to make the case for more funding and more resources, so that people can really commit the time to this kind of work. And we advocate that people should be remunerated for their time working on these projects. So and even though we aren't directly on the Safer and Stronger Communities project, not directly working with communities, we add to the settlement organizations that everybody should be paid for their time as if it's a job, because it's work, and we're doing work, and we're being paid right now. Most people in this room probably would be paid right now to do this work, so we shouldn't expect anybody to do it for free. And I don't really have much to add about the short-term nature, because that is how it is. I would just say that we have to, we can find ways of making sure that people get training in Nation. We have a lot of online resources. We can do online training, but I still don't think it can ever replace that face-to-face conversations that you can, working through the issues in the midst. So I think it's really important that we invest in a lot of face-to-face meetings and trainings and communities of practice. And in terms of tools, I think NCAS survey is potentially useful, and I think Officer Women has been exploring, different projects have been exploring the use of using some of those questions over time in projects so that we can also feed into or build on what NROS is collecting through the NCAS Community Attitude Survey.
Sorry, I'm just going to interrupt you. Can I stop Mike? This one's going through into the other room.
Oh. They're welcome.
I'm just going to use that.
Thanks a lot, sorry.
My goodness.
I feel like I've tracked a little bit of what part you want me to answer.
Any of the challenges or key challenges
That be great, Mike. In planning and implementation. So yeah, whatever springs to mind.
Yeah. I think common.
Is this working now? Yeah.
The common challenge are time and money. So I guess one of the things that we've been thinking a lot about in planning for our next evaluation is being very targeted in what we need to know, and not just collecting unnecessary data, because that takes up everyone's time, and so answering that question about what are the really important parts is really hard, but I think that's where it's worthwhile putting some more time and thought and to try to get that right from the start. And I think also we've got actually a lot of things to draw on now through Change the Story and Counting on Change, and a lot of this sort of stuff happening at the state level on outcomes and indicators. So also drawing on that in our work to help. I guess there's a lot out there that we can get started on, not starting from scratch anymore. I guess it feels like, since 5-10 years ago, where it was really felt like a bit more of a blank slate.
Great. Sorry, it's still going into the other room. I don't know what's going on. I don't like. It would be the only other option. We just talk.
Yeah, we'll project more.
Yeah, I'm really sorry.
No, that's okay.
I'll take this.
So I think what you just said, Monique, back really nicely to where we started in terms of one of the benefits of evaluation, or the purposes, is to feed into sector-wide knowledge and the broader evidence base, and also that can be a bit of a way of supplementing limited resources. If you look at yourself as part of a whole and you don't have to start from there, that like question for all three of you. There are other ways that you've used or you've seen that are good ways of working within resource-constrained environments. So, and by resources, like obviously money, funding is always an issue, but time is the other resource that we're often short on.
I think just because I was speaking to that a little bit already, so I guess all I'd add to that is planning for it from the start. We need to be thinking about our time and advocating to your managers or your organisations or your partnerships that is important and that we need to be allocating some time to it from the start. So you set that expectation and get that commitment. And then building in what you can through the project, trying to look at your activities and what can you build in without adding too much of a big thing happening sort of at the end. And like I said before, I think valuing qualitative data as well in what you're collecting.
I think in an ideal world, you'd be able to see this is the plan. This is the project proposal we have, this is the kind of work we want to do, and then at the same time, no, this is the evaluation framework we're working within. And I think in time that will be the case, but I think now we're still kind of, sometimes sometimes the funding comes through and then you get the evaluation framework and then you're like, okay, how do we make what our idea was into that? And But I think that relates to what Loxie was saying, that you could then, instead of in your, say, your first midterm report, you could then focus on the process and evaluate the process rather than the actual outcomes, because maybe you haven't actually got to those outcomes yet. But I think it's also really, really important, and this it kind of contradicts what you said, Monique, because you said collecting, like we collect too much, but maybe it's, what I guess the easier way to do it is like in a passive way, rather than trying to collect very specific things. I think what is helpful is just to collect as much as possible, so, but in a way that it's not too difficult. So like it's not added.
Like accessing what you are already sort of collecting. Anyway.
So for example, like we take minutes at all of our communities of practice, we take minutes at all of our training, and even if we don't know what we're looking for yet, at least we have it there so that when we're doing the evaluation report, we can draw on those notes and quotes and observations and be able to report on something based on what we've recorded. And then also just recording meetings that you have with project partners, and if you have the time, it's really, really important to sit down with your partners and come up with what are some indicators for our partnership that we want to be able to measure at the end of this project for our organizations working together in future. And that's really valuable also for funders to see. Yeah, I'll leave it there.
It was really interesting because I was going to say, and Monique was right when she said,
She was right.
Don't collect so much data and then not do anything with it. But I mean, you're both right, because maybe it's not about the volume of data you're collecting, but doing that process in a smarter way. So like you said, you are already collecting, you have resources and you're collecting material as you go along. You don't necessarily think of them as evaluation related pieces, but they can. Yeah. So I think, you're both right, because I mean, on one hand, you don't want to overburden yourself and then make the whole process so much more expensive and time-consuming by going out and collecting every single thing without really thinking through what you're going to do with that information. So I think planning ahead is probably key, like just knowing exactly what you want to collect and what you're going to do with it. And then I've forgotten my next point, but we can move on.
I'd like to just kind of circle back a little bit to a question I had when we were dealing with the microphone snafus, but I think that you touched on a little bit now around getting leaders to understand what is feasible to measure, and because that does seem like a key challenge, but also speaks to resource constraints. So I wonder if any of you had any thoughts around or ways that you have taken to advocate on behalf of your organisations, or to help that process through. And I think something that maybe I've observed is it can be difficult to feel empowered enough to go back and say you're asking for the wrong things. So how do we do that?
So this is the between you and your fund.
That's right. So for example, looking at being asked to measure impacts over a 2-year project, how do you reframe evaluations so that they work?
I think there's enough written about it, and that's public as well, that you can use to back your argument that it's not possible to measure impact within a year. Plenty of global evidence, there's plenty of this is why, the more people share what they've done in their evaluations and in their programs, the better it is, because then we can draw from all of these and present that as an argument to funders and build their capacity. I recalled what I was going to say in the previous question, and that was related to, I mean, if your funder if there isn't enough resources to do the evaluation, I mean, oftentimes you can just rescope it. So just think about, you're not going to evaluate every single site, or you're not going to evaluate every single community group. Maybe you'll select ones to just zoom in on, or maybe you only conduct it over a specific period of time. And you can say in your report, you know, we only looked at this because that's what budget allowed for. And if you wanted to look at everything else, then give us the money. Yeah. So I guess picking what you'll do, doing them well, and making sure it's funded properly.
Catherine and Monique, you've got other thoughts?
I think probably covered that fairly well. I think, it comes back to, like you were saying, you need to sometimes just advocate, make sure you draw on what's out there so that you can push back a bit. I think that it's also, in a way, we also are still learning, and you know that. So we, like an example of one of our projects that, not to do with our partnership, but a project that works with peer educators doing financial literacy education in migrant communities, and we had quite a discussion with the funder about the certain type of data that they wanted, that was written data from every participant who from women who English isn't their first language, and varying levels of written literacy. So in the end, we decided on, we agreed on an approach. Some of it we were arguing for a particular type of evaluation collection based on our experience, and they wanted a particular other type. We agreed on a compromise, and so we are collecting some of the data that they wanted. It's not maybe telling the whole picture, but we're doing that for a period of time, and then once we have some of that data to say, look, I don't think we need to measure this anymore, we can focus more on what we think will get the richer data, but maybe not quite in that every single participant form. So I think you can have conversations like that, and once you have some experience to draw on, you can sort of push that a little bit harder to say, you know, we have done this, we don't need to keep evaluating that part of it, now we can look at this type of evaluation. So that's just an example of, you know, that discussion happening in reality.
We have a similar experience, and and wanting very specific demographic data that sometimes isn't even relevant, because it might be someone speaking a certain language isn't from the same nationality as the person next to them in the room, and all. Yeah, a lot can't be categorized as cleanly or as neatly as some people might want to. So advocating and also supplementing that kind of quantitative data that we're being asked for with really nice stories and case studies, because that's what people really like. It's like, even if we, you know, if when it comes down to numbers, we need numbers to justify numbers of dollars. But at the end of the day, people really, really like stories. So yeah, being able to say, listen, this is why we're not measuring this specific thing, but we do have a story for you, and the program's going well, and we're delivering on what we said we would deliver on. It's just that we can't measure every little thing.
Yeah, for sure. And yeah, as a qualitative researcher, I have my own particular bias, but it numbers without a narrative, a little bit abstract.
Yeah, it's not. Yeah, it's definitely not the whole picture.
Yeah, and we're looking at that attitudinal behavioural change, changing social norms, so those stories do have an impact.
So we've heard a couple of mentions of some good resources. So Making Feminism Count is one that people should definitely look up. I'd like to ask all of you just for a couple of quick suggestions for people who are really just starting out. What resources would you recommend people look at?
I wrote a few down.
Great.
So the Women's Health Vic Evaluation Masterclass was really good. And then you get lots of resources out of that as well. The Vic Health Evaluating Projects for Prevention, and betterevaluation.org has a lot of resources.
Great.
Sorry.
All of the above. The Building Respectful Community evaluation report, the program logic, and the evaluation plan are all on our website, just as an example of a regional evaluation. So that's www.bfep.org. whin.org.au/BRC. And I had another one and now I've forgotten. So
the one I'm thinking of is a slightly different, so it's not training or anything like that. There's a monitoring and evaluation specialist / expert who on LinkedIn, her name is Anne Murray. I don't know if anyone follows her. Anne Murray Brown, that's right. And she does these amazing, if you don't follow her on LinkedIn, follow her, because she basically using these very simple, usually infographics or memes or things like that, demystify monitoring and evaluation. So she makes it very easy to understand. And they're sort of these bite-sized things that you can just look at and be like, oh, okay, I've learned something new. And she does it in a very engaging way, incredibly relevant. So yeah, she's somebody, if you want to follow, she's just a fairly like informal bit of content.
Yes, that's nice. Thank you. And I'm about to give up my own privilege and open the floor to questions. But before we do that, can you give us one thing that you'd like the audience to remember from our discussion today about M&E? Final thoughts.
So I guess one thing that comes up quite a lot for us, given that we work in the international and the Australian space, is we keep being reminded of how emerging this area is, and it does, it might create a lot of uncertainty or feelings of, I don't know how to do this properly in practitioners who are working in PVAW, but you're on the forefront of this new and emerging bit of work, so that's pretty normal. And also, I think you're doing great. And I guess another thing is that there is a lot of cross-learning to occur. So I think a lot of the times we focus in on what's happening in Victoria, which is, rightly, because so much good work is happening here and so much funding is being directed towards this work, and that's fair. There's also a lot of good work going on in low and middle income countries around prevention interventions and what works to prevent violence against women and girls. So I would encourage a bit more cross-learning, and just to flag in March, for example, the Equality Institute is bringing over a delegation from Colombia and Peru. They're interested in coming here to Victoria and Australia and learning about the whole of government approach to prevention. So there's all these opportunities, I guess is what I'm saying, for us to learn from each other.
I think, we haven't really talked about it today, and I think that I'm definitely going to look more at draw on more examples, like you said, from beyond Victoria. But on the other hand, I also think that, I just feel like now there is a really great opportunity to do some, for a research project in some of the community-based work, looking at some medium to longer term outcomes. There are some projects that have been happening now for long enough that a researcher could go back and follow up participants and find out what has been that longer term effect in their lives, and what has changed. And that would be such valuable data to inform all the current work happening. So any funders or researchers in the room, we're really interested in that area and trying to connect in with like this, dozens of community-based work that would be, potential for those sort of long, more in-depth research projects. For example, Good People Act Now, it's youth ambassadors for gender equity. That's been going for long enough. You could follow up with some of those participants. So I know we didn't discuss that, and that's I think maybe we need to do both, look more at some of international examples, but also I think there's opportunity, really strong opportunity here to do that as well.
Yeah, it would be great if we could do more extensions of projects rather than always having new projects.
Yeah.
Because, but maybe we'll get to a point where there's so many pilots that there won't be any more positive because then that's how you get long-term evaluation. And that's how you get, because once you have the commitment from the people involved in a project, they might still be committed, but if there isn't the funding to continue, then you can't come back to them in 2 years and say, hey, we're doing this again, can you join? It would be great to have that consistency, but that goes without saying. But I think capturing learnings, and like if it's something that doesn't fit in with your evaluation framework, then just capture it as a learning. And it would be great if we could always those learnings into public reports so that everybody could see, what we've learned. But it's kind of like it gives us an opportunity to have a kind of online or public community of practice in a way, because then we get to see what is the successes, what are the challenges in all of this type of work across a broad kind of, a broader picture of it. And I think one of the projects that we're doing, the Anne Rose called Participatory Action Research Project, that they've done such a great job of getting information about all of the projects across Australia that are doing prevention work in diverse communities, and then being able to share those learnings across different groups, which helps all of our work.
Thanks so much. Can you all join me in thanking our panel for a really rich conversation? And I'd like to open the floor up for questions or comments that you might have. We'd really like this to be as much of a conversation as possible. So anything that you would like to say, please feel welcome. And we've also got some questions hopefully coming in from our colleagues online. I'm glad to have you.
I'm really keen to understand how it might be possible to form partnerships with perhaps some of the smaller organisations that have very limited resources to bring them on board and create capacity, rather than partnerships being created with bigger organisations which then try to engage the smaller ones. I'd like to see whether your thoughts are on that and whether that's possible and how do we do that.
So we have one project right now that it's the Women's Health Workforce Capacity Building, and we, on one hand, are delivering free intersectionality training to women's health services, but then we also have a migrant women's organization community of practice. And the sizes of the organizations, the amount of resources they have vary, but a lot of members have, are much smaller, and that's the goal of that work, is to be able to raise the visibility of the work that these organizations have been doing for many years, and hopefully that's one way of laying a foundation to be able to say to funders, look at the work they're doing, put your funding there, because they're already doing that. So if your organization is in a position to be able to connect with smaller organizations and then amplify that voice.
I think so. In terms of working with smaller, like grassroots organisations that might have little funding, I think you need to look at ways that it works for them, like having to think about what are they already doing, how can you fit in with what they're doing, where we might have resourcing, how can that be used to enable them to participate in partnership work, and looking at capacity building as well, so that we're sharing our knowledge, so that then they can work out what the best what they want to do with organisation. So they get to build if you help them build the knowledge, then they can have the ideas or the solutions of what works for them. Does that sort of answer your question, or do you want to?
It does, but I guess I'm more interested in smaller organisations being involved in the actual partnerships, rather than just information going out to small organisations and involving them as a second thought. For me, it's about a picture of justice and equality, and bringing the smaller organisations on board at the same time as disseminating the information and educating and preventing. So they're actually part of the whole process, not just as a token at the end, as the outcome. So that's what I'm really keen. And I ask that because I see it all the time, particularly when it comes to putting it for funding or grants. Some of the smaller organisations are totally excluded, and particularly around family violence, the funding tends to go to the bigger organisations, have the knowledge, the skills, the resources. So that's what I'm really interested in. How do you make smaller organisations being part of partnerships? Yeah, from the very beginning, really. And I wonder if that's a commitment or something else that might need to happen. And I'm not sure of the thoughts of anybody else and the other organisations in the room, but that's certainly my experience from where I sit in my organisation.
Yeah, absolutely. And I think that's for some of organisations like ours that are funded. There's that question around how we're using our time equitably and which organisations are we working with. So that's something that we're, absolutely agree. I mean, also it goes to the relationships that you build, that you spend time on as well, so that when funding is available, then there is already that connection.
I wonder if, and I know this is just completely just throwing it out there, I wonder if a practical thing might be secondments. So if for a short period of time, someone from the smaller organisation could work really closely or in the larger organisation, someone from the larger organisation can work in the smaller organisation on a focused piece of work, this kind of exchange will hopefully build relationships, better understanding, and hopefully isn't like a resource intensive. Like it wouldn't be you wouldn't have to like necessarily find budget. Haven't really thought it through entirely. But when I was working at Our Watch, we did a number of these sorts of things where we would reach out to other organisations within the sector and say, would you be interested in having somebody come in and work here for a few months or work on a particular piece with us. So I don't know if that's one way to do it. I don't know.
It seems to me, and I'm in agreement with that, if we look, or my experience of funding is that funding is highly competitive and limited. We've already mentioned that people are time poor and resource poor. So if you are a smaller organisation with an idea, you often have to be sponsored by a larger organisation. And because they are in the pot for that competitive funding, your chance of them sponsoring you is nil. Just because, so it actually doesn't follow in some ways that the sort of the social justice and equity principles, but that's the reality in my experience of trying to access some of that funding, because the funders require that you have already a history in delivering projects, or that you are sponsored by an organisation. I think I agree with that person that the ability to capacity build and to actually deliver diversity in approach is limited by
Is that, so when you were talking earlier, Monique, about starting to interrogate what partnerships mean and how they work through the Building a Respectful Community project, does that speak to addressing some of those issues?
Perhaps. I think that the competitive nature of the funding environment is very, very difficult to navigate, and it's a constant question about which where you go. If you have another organisation that is going for funding, how you negotiate that or navigate that.
Hi. Thanks so much for the panel. So thanks for convening it. Thank you so much for really interesting
insightful experience, sharing it with us. I'm with Our Watch. I've just recently joined Our Watch, and I'm just with Our Watch for 12 months. I'm really interested to hear the experience in the sector. So I'm just leading from that question about partnership. I'm really interested in your experience and insight in terms of how you approach and how we might approach thinking about how we build out the evidence base for the theory and for the models. So, for example, we've talked about norms. We all work within a theory around norm change. So I'm wondering, what is your experience of what the options are for evaluation of projects, and then maybe across projects of being able to use a theory-based approach to evaluation around norms. But also we've talked about partnership. And I think one of the models that we're using in partnership is around influencing or amplifying or ripple effects. So I'm wondering also what might be some of our options in evaluation to build out that model, and to also, as part of that, linking back to what does that mean in terms of helping us to value the changes that we're contributing to and create meaning around them, particularly with our stakeholders as well.
I think it might be a place to I can speak to the partnership part, maybe, but maybe not the evaluation specific part. That's not my area of expertise. So I think that's interesting to think about the evaluating partnerships and how you amplify, how they might amplify, and the ripple effects of partnerships. It's so difficult to determine what's attributable to the partnership work. There's so many different things that at play. I think that that's a great word, and I think that is amplifying is a great word as well in terms of thinking about some of the smaller or grassroots organisations that partnerships might engage with. That there's a role there to amplify some of that work, to give that a bigger profile or as well. So I'm not sure if I've answered your question. You're thinking about evaluation approaches for partnerships.
Yeah, how we understand. We're not. I think the model is that we are working with many different stakeholders and partners to amplify effects or have ripple effects, because those partners are working with communities. Yeah. So how do we understand what that model of change is?
Yeah.
And use evaluation as a way of evidencing that we're evidencing and learning about that model of change.
I mean, for us, that affected, it speaks really well to that in counting on change, that what is it called, that grey level.
The infrastructure.
The prevention infrastructure. So looking at leadership, policies, workforce, collaboration, evaluation, and quality programming. So something that came out through our evaluation was, in terms of what value the partnership work was adding, was that partners reported, I mean, it's self-reporting, but that being part of the partnership increased the quality of their prevention work. And I think that was really, I think, important for us, because that is something in terms of really focusing on bringing people back to the evidence base and the principles in Change the Story. That's something that we really focus on, so to see that they felt that had an effect, I think, there, and looking at the particular areas where they are observing that the partnership had changed. Another area is in engaging across different levels of different organisations. So something that partners see as really valuable is that leadership engagement, where there's people working on the ground, they're doing the hard slog, and if they can have some more advocacy happening with their management and their CEO, that really support their work to get them to be valued.
Yeah, it sounds like, because I guess across our projects we're looking at these things and drawing them out, but not having often we don't have a focus on the partnership evaluation. So I guess having that already would be really helpful to go into a project saying we're going to evaluate the partnership and this is how we're going to, because otherwise we just get these learnings and don't know where to put them, or are, who holds them as well. Because that's a project in itself in a way, because then you're working together again on reflecting on the work that you're doing. I don't know if that makes sense.
It's an interesting point, and actually, I agree with the, if you were to use the grade level of counting on change and looking at some of the potential indicators that might come out of that might be really useful. I think Vic Health have developed a resource on partnerships and defining the different types of partnerships. That might also be a useful resource as well. I don't know if you mentioned that. I can't remember. And I think maybe one other point to make about this type of evaluating partnerships would be how much qualitative findings would be really key in this, because you're really talking to people and asking them how they're viewing a particular partnership, and whether that is so subjective. So if you're looking to tell that story, it is really, I would say it would be a method one with a very strong focus on people and telling you that they're feeling about partnership, and whether they're feeling valued, and whether they're feeling that it's useful.
What we have in some of our projects is University of Melbourne is doing the evaluation, so they're able to be kind of an independent party doing in-depth interviews with different project partners to find out what is the value of those partnerships, because it's quite difficult if you're both working together. Mm-hmm. Yeah, you don't want to offend each other or whatever.
I'll just take a question from our friends online. So should an evaluation aim to test the assumptions that were built into the program logic and the theory of change? And I'll editorialize by putting in a how. How might you go around about doing that?
Such a great question. And yes. I'd have to spend more time thinking that through. But it definitely, you don't want to take your theory of change or your monitoring and evaluation framework as a given. Sometimes it's developed by another person, sometimes it's developed in another time. So understanding that these things change, the context around you changes, and if we're looking at doing long-term work, then it's definitely going to change. Like what the framework you've built now is likely to undergo some tweaking by the time you're trying to figure out whether the impact is 10 or 20 years down the track. So I would say the answer is yes, but in terms of the how, that's far more complex, and maybe a starting point is just understanding it's okay to revisit the framework. The framework is not, set in stone. As long as you document the reasons why there might be changes in your framework as you go along, I think it's completely justifiable. Yeah.
Can you repeat the question?
Sure. Should an evaluation aim to test the assumptions that were built into the program logic and the theory of change?
Yeah. Same thing, I think, yes. But maybe that's something you think of closer to the end of the project, or as you're going through the project, that, this has changed, and how do we test that against what we originally thought or planned? But it would be good to go into a project thinking we're going to be testing this as we go, so that you're consciously doing it rather than, as an incidental.
Do we have a question for the floor?
I was interested in hearing from the panel about the pros and cons of doing this evaluation internally versus using an external evaluator, and at which points or which reasons you might be using your approach.
I think one of the points you raised, Catherine, about if you're trying to evaluate your partnerships, then maybe you're not the person who goes and asks your partner whether they enjoyed working with you. It's probably better to get an independent evaluator to do that. There's also, there's the internal and then there's the external, but there's also the hybrid model where you can work together. And I've in my own personal experience, I find that quite useful to have independent evaluators working alongside people who are internal, because the internal people can provide the context, can do the sense checking, the external people provide the independence and supposedly objectivity. So I would argue for the middle ground in terms of the pros and cons of these types of approaches. Obviously, independent evaluator is expensive, I guess, but then provides you with that much needed. If independence is your priority, then, and also the perception of independence is your priority, then perhaps you sort of have to go with an independent evaluator.
Yeah, and make the case for it in your funding application, like build it into the project, and know why you need that, why it makes sense.
I mean, we've definitely used that sort of hybrid model because, an independent evaluator to do the full evaluation is a huge cost. So both in our previous evaluation with Dr. Deborah Weston and this one, it's been more of a partnership with an evaluator or a researcher doing some parts of it. So, and then this one, like I said, we engaged Dr. Wei-Ling Kwok and also Melissa Collins, and to bring in people with expertise as you're building, so to do some bits that require that level of independence, like the focus groups and analysing the data and some of the data. But that has worked fairly well for us. I think also, you know so much about what's happening that you really, even I think if you do get an independent evaluator, that you do need to be really part of it and giving a lot of time to it anyway as well. It's not like just someone comes and nothing.
And on that, I think it's really useful if you are using the hybrid model, or even if you are using the independent external evaluator model, build into your contract capacity development for you or people within your organisation who might want to learn about evaluation, so that your evaluator doesn't just leave and then there's, they've produced the shiny report. But if you can get some, if you can work closely with the external evaluator and build some of your own capacity evaluation, then it becomes really useful. It's a good opportunity.
Hi.
I apologise, it's not really a question, but I just wanted to add to that conversation of a longer term project that I was involved in, coming in very green to evaluation and the impact and benefit of having capacity building through learning and learning for evaluation. I think that's something we can always come back to. So being sometimes thrown in the deep end and learning your own capacity and building your own skills and then bringing in an expert at the right time. And then that's from a sustainability long-term perspective, your team, and whether it's a small team who's currently lacking resources, could potentially partner on their other teammates, and it's a long-term step. I think sometimes we're very quick to pay lots of money for a consultant, and they come in with a document and they walk away. So how do we potentially embed their interest or my interest? And as a staff member, I certainly feel my own interest in investing in the work I was doing, because I became invested and accountable to the outcomes and the indicators and testing theories. So it's just a theory evaluation from my staff member's perspective.
Thanks so much. Hi.
Hi. A challenge I've come across in evaluating PVAW projects specifically has been around concerns to do with the types of data you might be collecting when it relates to, say, gender or family violence, and or who you're collecting that data from, and potential for public backlash, and that sort of thing. So I guess I was curious if that's also a challenge that any of you have come across, and how you might respond to that in terms of managing the different expectations of the funders, funding bodies for the evaluation, plus of the project itself.
So, sorry, are you, is it about the sensitivity of some information and the anonymity of it?
Yeah, and because of those concerns, I guess, wanting to limit or constrain the evaluation.
I guess one way, if you're using surveys or like SurveyMonkey or something, is that could be an anonymous way of collecting information, but it depends on if it's something very sensitive, you wouldn't want to put someone in a position.
Yeah.
I guess it depends on what the question is.
Yeah, and what you're going to do with that information. So there's definitely a lot of risks and safety issues around asking people. Do you mean like whether they're experiencing violence? Is that?
I guess it's the potential for backlash that might occur from participants themselves, or how that might be perceived.
Once the findings are presented, or while they're filling out the form, or
participating. So I guess managing those different expectations of them funders who then might not even want that data collected. Say if it's, so maybe let's part of the family violence sort of stuff, although I was meant more attitude towards and looking at the drivers of family violence, but even just thinking more around gender, understandings of that, stereotypes of gender inequity. Is that something I guess you can come across, and how is that managed?
So when someone's say participating in a survey and the questions themselves provoke a response in them and some backlash?
Yeah, I mean even similar questions to the NCAS survey, and that sort of thing, that does sometimes trigger responses by the participants, by themselves, or even from the funding body, that they don't even want those questions asked for fear of repercussions for the project itself, in terms of that it's man bashing, that we're promoting gender fluidity.
I mean, I think that it's not just in collecting survey data or evaluation that we come up against that sort of thing. So that's part of the whole project. So we do need to be ready to, we need to know why we're doing what we're doing, and need to be able to respond to that. And we're going to experience resistance and backlash in this work that comes with it. So if you're working with a group or an organisation, making sure that you work with them before going to participants or staff, or if you're thinking like a staff survey or a survey in a particular population group, who's working with those people, and are they, so if you've got a women's group or a community group who facilitates the group, how do you work with them first to build their capacity to understand the project, and also be able to feel more confident responding to any resistance or backlash, and understanding also that some resistance or backlash might come from people's own, their own lived experience, and how to respond sensitively to that as well, being, ready that people can respond to disclosures and so on. So there just sometimes might need to be more, the preparation might need to take a bit longer than maybe you think when you get excited about a project and want to get into it. There's just some more of that preparation, but I wouldn't shy away from asking questions that promote resistance or backlash, because that is also part of the work that we're doing, unless there's concerns about people's safety.
Yeah, that comes back to time, having the time to build that capacity and awareness, and often, we don't have the time, but that's very important that we, raise that awareness and capacity building before asking those questions. But I think also the type of language that you use makes a difference as well. So maybe sometimes it would be about testing it with people first, or easing into the topic. So it might be about levels of readiness because of how we approach that topic.
Tailoring it to the audience in terms of the language, I think is also important.
I don't want to put you on the spot, but Violetta, and you can. We just say anything, you can reject it. But Violetta led a lot of the work on the NCAS survey, and I don't know if you have any reflections to share in terms of like how the NCAS survey, obviously tried to maybe mitigate against some of the backlash that would come from people when they're responding to the survey questions, even if they're fairly like attitude related questions, not even related to whether they're experiencing violence.
Well, so one thing was that the questions were actually mainly in the negative. So most of the people would have been offended by the questions for being sexist rather than having a backlash. But that was just the way they were framed. So in terms of that, we were mainly prepared for people reacting like they were overly enthusiastic and giving horribly sexist comments to the people who were actually doing the interviews, as well as disclosing. So those are the main things that we were trying to prepare people for. So we did a lot of training with all of the interviewers. So preparing them firstly for to understand violence against women, scope of the problem, why we were doing this, why we were asking these questions, as well as preparing them with how to manage responses. They also are kind of used to having to deal with people not wanting to even do surveys in general. So that kind of aggression as well. We also had a psychologist that could help them, and there was staff that could support them if they felt that they were getting abuse from people on the phone. As well as for respondents, they had, they offered resources and telephone numbers for people who might need support, because they did bring up things like, oh, my daughter experienced this or that. So there was a lot of that kind of disclosure that was going on. So the staff was trained, or the interviewers were trained to be able to respond to that. But I think in terms of the backlash as well was about when we released the findings and how are we going to manage that, because that was where it got a lot of media attention, and we made sure that we had responses basically ready. So we tried to prepare for what were all of the different aspects of backlash that we were going to be getting, and that people who are also talking about our findings were going to be getting, because a lot of people in the sector were talking about it as well, and just being prepared with what to say and when to respond and when not to respond, because sometimes it's better just to leave it alone. And there's lots of resources out there in terms of backlash and having the words ready. So you feel protected and like you're not scared, like they're going to say the thing and I'm not going to know what to say. You've got some words kind of ready to go, so you don't feel quite as anxious about that.
The curly questions is a good one.
Yeah.
That's a helpful resource. Yeah. From Women's Health. Women's Health West. Oh, Women's Health West.
And I think Big Health has done some stuff as well.
Yeah.
Thanks.
It is the hard part.
Any other questions?
Yes. So my question is more towards when we develop some of the evaluation question, and I guess it's always more towards what works or doesn't work in a project. But is there any any research or any resource that we can refer to that also talks about that? Okay, yes, this works, but why did it work, or it did not work, or for whom actually it worked? So then when we talk about for whom, then maybe that intersectional lens comes in, that okay, yes, this project did work, but not for these people or for these people. But so how do we ensure that our evaluation questions are also embedded well enough, good enough, that we capture all that information?
It's a really good question. And my brain is just thinking, oh, it's all context, and I kind of want to find out what project you're working on, and then I want to sit down with you and we can go through the questions.
Shall I work together?
All right.
Faith communities.
Okay. This is really putting us on the spot.
No, I mean, you can take it general as well. I mean, not necessarily a project. I mean, because I work with faith communities, but also, I mean, if it's more towards prevention work, then how do we ensure that we are taking all the evaluation questions, which just does not only answer what, but for whom and whys of the project?
I think it's really tricky also if you're wanting to analyse the data, but with a small group you may not want to be collecting demographic data. How do you?
Yeah, I guess, well, I think, and Amrose, when Amrose did the NCAS survey for NMESC. Yeah, people who have from non-main English speaking countries. Yeah, it's such a good question because it's sensitive information. It's like on one hand we want to be able to highlight the amazing work that certain communities are doing, but then on the other we don't want to say anything that will then give people who will discriminate against them for one reason or another any kind of leverage or reason to say that culture has a problem with violence for this reason. So I guess it's about how we frame it when we publicize that information so that it's still not generally applicable, but so that it's still about the migrant experience, but it's not necessarily about one specific faith or one specific language spoken or nationality. It's really tricky. I don't have an answer.
Maybe it's partly some of the practical steps in the 10 steps. So I'm looking at number 1, 2, and 3. So if you, for example, are developing your questions and consulting with the relevant stakeholders and representatives, then you'll be able to capture the right things more so than if you develop them on your own. And documenting relevant assumptions, sitting down before you even develop the questions and almost working together. You usually work better as a group when you talk about what you're assuming and what assumptions are going into the evaluation and into the project. So once you have those documented, you interrogate them, applying your intersectional lens and looking at through a power paradigm. And that will take you closer to I guess that'll give you the basis for when you develop the questions. In terms of any other resources that might be useful, and I think it through. Within Counting on Change, there's a chapter about intersectional monitoring and evaluation, but it can, if you're looking at evaluation only, it could apply. There's some questions that broad-based questions that you could ask yourself as you're developing your research evaluation questions.
So
in Counting on Change, there is a little section on intersectional approach.
Is it also like with smaller projects being able to offer interviews as part of the data collection that allow people to talk about why it might not have worked for them, and that while that might only be a few people out of the whole, it gives them a chance to explain why it didn't work for them, like having that sort of data as well.
And it is that process of validation throughout, isn't it? Yeah. So even so the questions and the assumptions is one part, but going back and checking how the information is framed and what gets communicated outwardly and how that gets done as well in that agency.
Yeah. And that it's not individualized, that it's always looking at the stress that are impacting. But yeah, that would be useful for him in some cases to be able to look at a very specific policy or a very specific process that affects certain communities.
I'm going to jump in with a follow-on question. Something that we haven't talked about so much is communicating what hasn't worked. So, there's obviously that it's so crucial. It's crucial to learning. It's crucial to our work. It's crucial to the evidence base. It's difficult in moving from pilot to phase 2. So how do we balance those different priorities and imperatives?
I guess if you're presenting, and I would always encourage people to present what hasn't worked alongside what has worked. The only way being transparent is, very valuable for everyone else in the sector, so that people aren't repeating the same mistakes that were made. So maybe a way to make the findings of what hasn't worked more palatable is to then recommend, and usually you're asked to do this anyway, recommendations as to what could work. So thinking those through very carefully, consulting on them and presenting them and making them feasible as well. So being realistic about what you're recommending could potentially be a way
to, I guess, soften the presentation of findings on things that didn't work?
There's a couple of things in there. So if it's a pilot project that you're seeking more funding for, if you're really getting data back that it's not working, then should you really be continuing to seek funding for it? Or maybe you need to change the approach. I think one of the problems that we can have is that to get funding, they might want lots of reach data or quantitative data in certain ways, whereas you might know from your pilot project that they're through anecdotal evidence or your own observations or other sort of more informal things, that there actually are some really positive gains being made. So how do you advocate for that sort of data to be valued, or how you need to think about then how you might put it as in a way that is how can you collect that data in a way that's valid? Does that make sense? I'm not an evaluator, so I don't always use the right words sometimes. But I think also that's about going for funding, but then also in terms of communicating what isn't working and what is challenging, I think creating an environment among practitioners where we are in a learning environment that we feel like it's safe to be able to share some of the things that didn't work. That's really important, and not being being open to that we are learning, we are making mistakes sometimes, and that's part of the process, and we're not going to improve if we don't actually talk about what didn't work.
And advocating as a sector where it's possible to come together and all agree that this is something that's not working, and to publicly state that, which is difficult to get that collective voice. But
And I think one of the best conference panels I've ever been to was called the Museum of Failed Research, and creating those, exactly as you say, those spaces where we can say what hasn't worked and what we learned from it, really instructive, and also build a really nice sense of camaraderie too. And I think that's a really nice note to finish on, and recognising that the Partners in Prevention Network does create some of those spaces for collegiate learning. So I want to first thank our panel for their wonderful contributions today, and all of you for your questions that you put. And everyone who is part of Partners in Prevention, and also maybe colleagues who joined us for the first time. Just like I said, this is our first event for 2020. There'll be more to come, and an exciting program, and we really look forward to working with all of you. We're going to break for lunch. I hope that you can stick around and have a chat and meet some new people. We've got some evaluation forms on your chairs, those feedback forms. So considering you're all here, I hope that you'll complete them for us, so that we can continue to improve our own work. So thanks to everyone who's joined us online as well, and I hope to see you all at events through the year.
Thank you. And we have lunch ready in the Brickell room.
So one more thing, I've been remiss in not thanking the hardworking PVAW team at DBRCB, and especially Queenie, putting together this event. That was a marathon.